Yeah, I mean, that seems like a really obvious good faith point because, like, you're with a mental health professional. Like, obviously, everything's not going okay. You think you're crazy or something close to it. I mean, sure, there's a less blunt term, but if you take that person that's dealing with these extreme mental health issues, has razor slashes on their arm and so on, and agree with everything they're saying, that strikes me as not only idiotic, but also a term might be iatrogenic. Like, there's going to be a doctor cause harm there. That's going to be profoundly negative. And Alison Shriver, I believe, uses that term in the book Bad Therapy, where she says, obviously there are people, and if pushed, I'd probably agree with this, that are returning war veterans or something that need to go talk to someone who's actually a psychologist or a psychiatrist and can explain why they're seeing burning enemy soldiers in their dreams and so on. You take people that have normal day-to-day issues at the my girl said no level, which really does seem to inspire a lot of the manosphere, and you put them in a room with someone who's basically a doctor, who can prescribe pills, who's going to do these mind-wrenching talk techniques, so on, you run the risk of the negative effects of that far outweighing the positive. So first, is the doctor even willing to do that? Or is the doctor just going to be like, yeah, you're great, that's point one, for $600 an hour? Or two, even if you get past that, are you at a level where you need that level of care? And I don't think most people are. I mean, if you look at psych med prescriptions in the USA, antidepressants, Wellbutrin, Prozac, Adderall, they're 22 times South Korea and Switzerland, if I have that correct. Now, South Korea and Switzerland...
I didn't know that.
I'm sorry?
I didn't know that. Wow.
Yeah, I'd have to look up the exact numbers, but it's like the number of... I guess it couldn't be 22% this year, but the number of young white women that are diagnosably mentally ill in the USA and that are on some kind of drug, I think is 56%. Switzerland among females is 5%.